Dy'Min J. Cannon. Hello, and welcome to our sjgcmedia.com coronavirus special podcast. The coronavirus is a respiratory disease that shows similar symptoms to the flu. Symptoms can include coughing, high fever, and diarrhea. The virus originated from China and has quickly spread across the country and affected millions. As the U.S. struggles to limit the spread of the highly contagious coronavirus, also known as COVID-19, the number of healthcare workers ordered to self-quarantine because of potential exposure to an infected patient is increasing at an exponential pace. As of today, women in the U.S. hold 76% of healthcare jobs, according to the U.S. Census. In nursing, where workers are on the front line of patient interactions, women make up more than 85% of the workforce. In addition to women being the majority of healthcare workers in the United States, women are the primary caretakers in their families. This means that many women in the healthcare field are balancing a strict work life and home life. Next, we will hear from Tiana Jackson, a nursing assistant at Covenant Hospital in Saginaw, Michigan.
My experience has been kind of hard. I work in rehabilitation, and working with rehabilitation, you get patients from all over. Not just from our county, but from other surrounding areas as well. And with that being said, they're entering our facility and we're not knowing if they were in contact with someone with the COVID-19 or if they even have the COVID-19. A lot of people are not getting tested until they show symptoms. And I personally feel that you should be tested before you enter a facility, especially during rehabilitation.
Jackson also shared her experience balancing a work life and home life.
It's not hard for me to balance, work and home. I keep them both separate. When I'm at work, I'm at work. I'm there for my patients. I'm there for the doctors and nurses. That's it. But when I'm home, I come home to my kids. My home is my safe place. The place I can relax. The place I can let stress go. So, no, it's not hard at all.
Amber Jackson shared her experience as working as a CNA at Hoyt Rehab Nursing Center in Saginaw, Michigan.
Experience during this pandemic has been very challenging. Just because you just don't know. It's a lot of things going on right now, and it's just unclear. Everything is unclear. We're supposed to wear the mask and the hand washing and the not going anywhere and social distancing. But, we just don't know, and as a mother, it's very scary because like I said, you don't know, at this point, I'm, jeopardizing. I'm going out. I'm in the work field. This is what I signed up for. But it's forget me. I will feel more worse to bring it home to my kid or, my spouse or, or someone I take care of. It's just scary. And I just try to stay positive about working by keeping in mind that I am helping someone in the process and that, we as CNAs, we play a big part in the medical field. And just knowing that you helping someone that can't help themselves, that's rewarding, very rewarding. I've been in this field for 8 years, so I've gotten used to the everyday task and, I learned how to keep balance and making sure, work is work. And when I get home, home is home.
Healthcare workers put their health on the front lines of caring for patients with confirmed or possible infections with the coronavirus outbreak, and therefore they have an increased risk of exposure to this virus. With the number of confirmed COVID-19 cases rising day by day, a quarantine response of this size will likely leave the healthcare system overwhelmed, short-staffed, and emotional. Let's continue to support and uplift every healthcare worker working during this pandemic. I am Dy'Min Cannon, reporting for sjgcmedia.com.